we got along pretty good. I mean, like a little sibling, she probably, she got into a lot of stuff that I did. We both, had our Pokemon cards, and we each had a video game with our Game Boy and everything.
Having an older brother, I kind of felt like, like all my other friends who had older brothers, they'd drive them places, or they'd rely on them for things, or they would treat them to certain stuff. And it felt like I was always giving my brother rides around town because he didn't have a license, or giving him money and not really knowing where it went.
I work at Cherry Health to help the clients, to help reduce the overdose risk in West Michigan so we have less individuals who are dying, to help address and fight against the opioid epidemic. That really is my passion.
There's one time, it was when I was in college and I was coming home for the weekend, and when I came through the door, my mom was sleeping. And my brother had been leaned over the kitchen table. He was really pale and purple, and I was like, this is it. I was like, this is the time. I was like, he's dead. So I remember just trying to poke him. And he ended up waking up, but he was just on so many tranquilizers and stuff like that he just wasn't even functioning. And I think it just freaked me out. I remember I just left, and I was like, I don't want to be there for this.
She doesn't want to come over for dinner if I'm falling asleep in my food, and so she eventually, less and less, until didn't talk really. That killed me. I mean, it's funny when you're using, it's all about self-deception. So in my head, she was overreacting, or she was being unfair. And it's not until those moments of sobriety where you actually see things as they are, and those are crushing moments when reality sets in. It's overwhelming, It's like getting hit over the head with reality, Helped me get into treatment, I would say.
When clients come to Cherry Health, they're receiving both their medication and therapy in a comprehensive manner to address both their substance abuse and their mental health issues.
Trying to quit opiates is probably the worst thing I've ever been through. And I've been through it a number of times. Opiate withdrawal is like the worst flu you've ever had, times 10, with fever, anxiety through the roof, and depression and shame, and the worst part about it is you're physically so ill, and at the same time you're thinking clearly for the first time in forever, and reality's just crushing you. The reality of what you've done to your life and what you've done to the people you love. These are all things that you haven't thought about in months, and they just come crashing on you, and you're sick. You're so sick. And the only thing you need is one pill or one shot, and everything's gonna be fine again.
MAT is more effective for clients because they're not forced to abstain from opiates, and that their brain is able to start to heal and create dopamine on its own and work on those environmental stressors and triggers and things that started them using to begin with. It has a higher chance of success versus when a client goes to detox or residential.
I hadn't seen him for probably 8 months, maybe. I didn't really talk to him. He was kind of, I think, starting at Cherry Health. I just realized he was fully there. When you were having a conversation with him, he was present. And it wasn't, he wasn't high or he wasn't on drugs. It was you had that person back, and there was still some struggle and stuff like that, but I realized that it felt like the first time he wasn't just gonna slip right back into it in a couple months.
I'm relieved nowadays that I can tell my family's not worried about me all the time. They trust me. I never thought I'd get trust back with my family. I can just see it in their eyes when I leave. They're not wondering if they're gonna see me again or anything like that. It feels good to know that they know that I'm gonna be all right, that I can take care of myself, and to not burden them with that worry is great. It's awesome.
I think maybe it's easy to make excuses for yourself if you're not held accountable for things. So I think with the Cherry Health, Sam was required to show up and do these drug tests and pass them, and he was also getting extra counseling and therapy, whereas I think all the other times that he tried to do it on his own, it might have just been too much, and it's easy to tell yourself well, maybe next time, or I'll just give into it this one time.
I didn't have insurance when I came to Cherry Health, and I mean, I didn't have a job, I had nothing. And if it wasn't for donations, I wouldn't have been accepted, I wouldn't be there. And I'd probably still be using drugs, you know, or worse.
It's amazing that people would donate their own money to then put into someone else's recovery. Because especially, I mean, a lot of addicts don't usually decide that they want to recover until they've hit rock bottom. And then if you're already at rock bottom, how do you pay for and afford to make yourself better?
I just want her to know that, you know, obviously I love her to death. She's my only sister, my only sibling, and I've really done her wrong a lot over the years. I just want her to know that, you know, I'm trying to make it better, and hopefully I will.
I guess I just want him to know that I am really proud of him. What he did wasn't an easy thing to do. I respect him, and he's a really good brother, and we have a lot of fun, and it's nice to have that person again because you've grown up with them and they understand your quirks and they kind of love you anyway. And we connect, we love playing music together and stuff like that, so it's just, I can't imagine not having him. So I'm glad that he's in my life and that he's doing well.